A baby's first cry is one of the most beautiful sounds. When a healthy mom brings a healthy baby into the world, we celebrate that new life. But too often, this moment instead brings sadness. In Uganda, a country the size of the U.S. state of Oregon, thousands of women and more than 30,000 babies die every year during pregnancy and childbirth. Almost all of these deaths are unnecessary. They could be prevented, but women in Uganda experience many challenges. Sometimes families struggle to know when they need to seek care. They may not recognize that there is a problem until it is too late to get the help they need.
She has ever experienced that her brother-in-law's wife experienced that. She got labor pains when she was home and they didn't have transport to take her to the health center. So instead they got someone like her to help, and in turn, after giving birth she bled, and that time they rushed her to hospital. She didn't make it, so she died on that way.
Even when they reach a health facility, the quality of care is often lacking. Some facilities lack enough providers. Others do not have enough supplies. Many do not even have reliable electricity. Just imagine giving birth in the dark.
Actually, I've ever worked in a regional hospital, and so happened power went off, and there was no solar by then. So we were forced to use our phones in the torch. At times, these lights of the torch may not view any tear inside the mother.
So often, people from other countries see our problems and they think that we need them to save us. But we know our problems. We know that our mothers and babies are dying. For a long time, the problem was that we did not know how to work together to use the limited resources and solve our problems. But in 2008, that started to change. Some of us started working together with a team of students. At first, we worked together on some small projects, but over time, our work grew and grew to where now. Safe Mothers, Safe Babies has become what it is today.
We work together to disrupt traditional thinking.
Because many people are dying because of a simple thing of transport. So he's saying everyone should learn, because he is sure that if the program didn't save his daughter, maybe she would pass away, or the baby also pass away. But now the baby and the daughter, they're okay because of the program.
Example to others, other NGOs also to come in to support the mothers to reduce maternal and mortality rate.
We are so glad for whatever you have done for us. They have sold our solar, the pictoscope, so we are so grateful.
Many projects have come, they have had a lot of money, they have done a very good job, but after the expiry of their lifespan, they left without leaving anything behind, because the program was so expensive and unsustainable. Even the local government could not sustain the project, so it died a natural death. But the one you have brought, it started right from the grassroots. You have built the capacity of the communities so that they can sustain it.
To understand and talk about maternal health, to identify the problems and find sustainable ways to stop them. We form community groups who use drama, song, and home-based outreach to change health behaviors. We use motorcycle ambulances and family savings projects to increase the physical and financial access to hospitals. We work with the hospitals and healthcare providers to improve the quality of care, to improve medications, and ensure that there is electricity for when the power goes out. That is why SAFE is different. We work together to empower women. We work with the whole family, including the men. And it works. No woman should die while bringing life into the world. No child should when their life has just begun. Join us in fighting for life.